To order, would the board clerk take attendance?
District 1, Barbara McQuinn.
Here.
District 2, Chuck Shaw. Here. District 3, Karen Brill. Here. District 4, Erica Whitfield. Here. District 5, Frank Barbieri.
Here.
District 6, Marcia Andrews.
Here.
District 7, Deborah Robinson.
All right. We have quorum. Did we do the pledge earlier? Yes, we did. So, Mr. Superintendent, workshop items?
Yes, at this time, Ms. Wanda Paul, Chief Operating Officer, and Ms. Allison Momblo, our Director over Food Services, will present a workshop on operations policies.
Good afternoon, Chairman Barbieri, Vice Chair Mr. Shaw, and board members. I have a number of policies to bring before you for your approval or input. First up is our wellness policy, policy 2.035. Allison Momblu will be providing that information on that policy.
Thank you very much. And congratulations on your re-elections and also your new positions. So policy 2.035, wellness promotion. First, I would like to, before I get into the policy itself, I would just like to let you know that School Food Service oversees this policy, but there are many people throughout the district and departments that have collaborated to bring this policy to you today, and many of them are here. So I just want to thank them very much for the collaboration of everyone putting this policy together, and they're here in case we have questions as well as we move forward. So the scope of this policy fulfills the requirements under federal and Florida laws that school districts have a local school wellness policy to promote student health, safety, and the reduction of childhood obesity. It creates a wellness culture for all students and staff, emphasizing the connection between learning and health. Some of the proposed revisions to the policy include, I'm going to read through these, but there were many changes to this policy, and they were attached to the board docs. So one of the changes was the consolidation of previous wellness promotion policy and the goals and objectives. They used to be two different documents, now they are one. The alignment with the Centers for Disease Control and Prevention, CDC, the whole school, whole community, whole child, which is called WISC, model, and you can see our model up in the corner there. That's our newly designed WISC model for the school district. The incorporation of changes in federal guidelines and state statutes, changing language from should to must where feasible or where required by law, such as the recess requirements, and adding items from multiple departments to increase our wellness culture throughout the district. For the leadership section of the policy, the Healthy School Team has been established to ensure schools remain in compliance with the Smart Snacks legislation and support this policy. That is a Healthy School Team that is mandated by Florida statute, and we have a Healthy School Team in every school. Internal District Wellness Promotion Collaboration Team has now been developed, and we've added that to the policy, and a Wellness Promotion Task Force, which we've had the task force since 2006, and we meet at least 3 to 5 times a year, and that is continuing. So the first component of the WISC model is our physical education and physical activity. We've added all high school physical education instructors must be state certified. Certificated. All elementary schools must provide at least 100 minutes of recess each week. It prohibits the exclusion of students from recess for disciplinary or performance in the classroom reasons, and prohibits the use of recess to meet time requirements of the physical education policy. Moving along to nutrition, environment, and services. It strategically integrates nutrition education into the student's day, includes incorporating into after-school programs, utilize the best procurement practices to minimize and or eliminate trans fats and artificial flavors and colors in our foods and beverages that we are purchasing for the kids and staff. Marketing of food products must be limited to only Smart Snack compliant foods per the USDA. Only prepackaged sealed store-bought items are allowed to be brought in for consumption by students during the school day. And school food service, culinary programs, food pantries, classroom parties, concession stands, meetings, etc. must all adhere to regulations. Next is our counseling, psychological, and social services. We should provide comprehensive school counseling programs and development and implementation of a mental health assistance plan as required by the Marjorie Stoneham Douglas Public Safety Act, which must focus on evidence-based mental health treatments. And social emotional climate, create positive behavior support and develop school and emotional competencies in students through modeling, explicit instruction, and cueing and coaching during core instruction. School-based teams are tasked with identifying and removing academic, behavioral, or social emotional barriers to student learning. Teams must partner with parents and guardians and relevant outside agencies. For health education on our wheel, students are allowed to possess and use a topical non-spray lotion sunscreen product while on school property with parents' permission. School nurses will serve as a conduit for health education by providing resources and health-related support. Aftercare programs should promote healthy lifestyles and healthy decision-making, provides comprehensive and coordinated health education content and resources, and human growth and development curriculum is offered. For health services, provide basic health screenings and community referrals, support students with chronic health conditions, and support health and wellness group activities and initiatives, and collaborate with partners of health services and create a school health services plan. Employee wellness, as we wrap around the bottom there, wellness champions must be a member of the Healthy School team. We encourage access to healthy food options at staff meetings and celebrations to include smart snack compliant options and staff vending machines. Staff promoting and modeling healthy eating and drinking and physical activity behaviors. Required lactation room for staff at every district building and school. Provide updates and reminders to staff on health rewards incentive programs. Physical environment, one or more safe school officers at each school facility per the Marjorie Stoneham Douglas Public Safety Act. Each school should create a sustainability plan. Designation of a green champion at each school to lead sustainability activities via the green team. And garden procedures, safety protocols, and resources should be provided to schools. For family engagement, the collaboration between parents and our guardians and school staff is instrumental in the promotion of a positive environment for learning and developmental growth for students. Community involvement promotes collaborative partnerships with community agencies and encourages community involvement in all three of our committees there. We have the Wellness Promotion Policy Development, the Wellness Promotion Task Force meetings, and also school-based wellness activities such as health fairs, parent trainings, screening, staff events, sporting events, etc. And so that completes the 10 components on the WISC model. And then we have how are we going to evaluate this policy? Evaluations will be done through the Wellness Promotion Policy Annual Report, a Healthy School Team Annual Assessment, and also a triennial progress assessment. And we will inform the public through the Wellness Promotion Policy, through the information through updates to students, parents, and staff and community as applicable. Any questions on the policy?
Mrs. Whitfield?
Thank you. I just wanted to ask a question. I've been particularly concerned lately about the suicides in the country and in our district. And I was wondering, in our list of items that we do education on or resources that we make available, I noticed that there's not anything that really gives any support to students specifically related to that, or if there's anything that ties into I think it's our new public health crisis that's kind of really becoming big. So I just wanted to see if you had anything that ties into that. I'm sorry to drop this on you, but this has just become in my head recently.
We do have the Youth Risk Behavior Survey that is done, and I believe that's one of the topics included in there when the students respond to that. I don't know if Pete Stewart is here. Yes? Would you like to come up for just 1 minute? Is there more that you might be able to answer on that topic? Putting him on the spot now. Is there, and yeah. Thank you.
Our youth risk behavior survey is done every 2 years, as many of you know, and it does provide some information related to that. There is some some piecemeal education that's done in schools as far as mental health services. We also work with positive development related to our gender studies curriculum, but certainly we could offer specific information or education related to suicide and suicide prevention.
So there are organizations in the community that provide, even the national program or the 211 locally for the suicide prevention hotline. I just feel like we need to do more. Something has to be done to kind of educate students on the supports that are available for them, because we're just really not stopping it. So I'm open to any ideas. I just and looking through the policies, we seem to be covering a lot of health topics, and that one, I think could have a line really specific to how we would try to tackle that within our policy. So anyway, I know we're workshopping this, so maybe if you want to think about it and come back, if there's anything that
And I can talk to others as well and see if we can maybe have a line added into their specific to
Thank you.
suicide. Yeah.
And if I also, some of that is touched on in the social and emotional learning that we're working on, so that hits it early, and then we would progress through middle and high school.
Mrs. Brill?
Thank you. And I don't have a question, but I do want to say that of all the areas in the school district, I think what we do for wellness, what we do in food service is just one step above what I see and what I hear from other districts. I think our efforts to feeding students, to making sure that over the summer they're fed, to make sure that they have free breakfast, looking at the meals, knowing, because I do have my son in food service where he's told me one recipe wasn't working, Mom, and they came in and tweaked it because the kids didn't like it. So I'm enormously impressed and very excited, and I think that you're unsung heroes in the wellness area because we are doing so much. There will always be other things, as Mrs. Whitfield mentioned, with the suicide prevention, but this district has come a long way from the time my children were there, so I just want to say thank you.
Thank you.
Mrs. Andrews?
And I have to concur with Mrs. Brill. I've been around a long time, and school food service has always been great, but we have been getting much more into the wellness piece to really make sure that we protect our students and our adults, and really working in our communities to make sure that parents know that there is a connection with the school and feeding the children. So it's always been at the top to get top rates from me because of the work that's being done, and it always starts with the leader. So I thank you for all of your people and all of your leadership skills that's taken us to the next level.
Thank you.
Mrs. Whitfield?
Thank you. Since this is a workshop, let me just bring up all my things that I'm interested in. If there is any way we could include health as a class again, that would be something that would just make me sing, just in every single way. So I promise to sing for you if you get health as a class. But I just think if there's any way that we as a curriculum, none of my curriculum people are looking up, hi. If we could think about it, if we could see a way to put it into the plan, I think, we are realizing now that this has become a central part of our ability to educate students, is to keep them safe and to keep them knowing about not only their health, but their emotional health, their mental health. And I think it's crucial because I hate losing kids. So anyway, if we could think about it again as a district, I know the state doesn't give us a lot of support, but we can do a lot of magical things here. So anyway, thank you.
Mrs. Andrews?
Thank you. And just one last thing. I was at the Florida School Boards Association meeting, and I met some people that knew you and know the work that we're doing here. And one of the pieces we were talking about is the supper program. And he told me all the things that we can do to even increase the feeding of people in the evening, our children. So I'm going to be sitting down with you soon and sharing that information. And he says you're already on top of it, but he's going to help us to figure out how we can get some additional funding so that we can expand the program.
Wonderful.
Thank you.
Thank you.
Any other questions? All right, Mr. Superintendent?
Yes, Ms. Paul, you can keep going.
Okay, the next policy, thank you, Alice.
Thank you.
The next policy we have coming forward is Policy 2.28, which addresses school district-owned vehicles. I have Crystal Washington, General Manager of Operations, as well as Shane Searchwell, the Director of Transportation.
Good afternoon. Good afternoon, Chairman Barbieri and Vice Chair Shaw. Congratulations on all of the re-elected board members and the rest of the board members. Similar to the wellness policy, Policy 2.28 is also a result of a collaboration with multiple departments. I'd also like to thank them. Policy 2.28 defines the use of district-owned vehicles and establishes operational procedures, including IRS regulations concerning commuting. Revisions today include clarification of definitions and procedures for vehicles and drivers, expansion of the policy to include the use of GPS for record keeping, updated language to stay current with IRS regulations, simplification of language, updated language to stay current with legal practices. And most of these revisions are as a result of the Inspector General's audit of school district take-home vehicles, which was conducted last year. These are the 4 findings for the audit of district take-home vehicles. So the first one is circumvention of the take-home vehicle policy by parking the vehicles at the facility closest to the employees' homes. The second finding was there was no vehicle assignment registration form. The third finding was there was no vehicle utilization log, and the fourth was there was no automobile liability insurance coverage that was recorded for people who were driving the vehicles. All drivers are required to register annually, and this information will be monitored with the Department of Motor Vehicles to ensure all of the driver's licenses are valid. All managers will have the ability to utilize electronic records for utilization. And lastly, any employee who meets certain criteria, which we'll get into, are allowed to park at regional parking facilities. District-owned vehicles include any vehicle that is leased, rented, or owned by the school district, and there are 3 main categories, which I'll walk you through. The first one is a pool vehicle. These are for work purposes only and not for the employee's commute. There's no personal utilization for these vehicles. These include all of our service vehicles. The overnight parking for these vehicles must be at a secured primary work location, and any use outside of that is prohibited. The second category is the district-assigned vehicle. Unlike pool vehicles, pool vehicles are utilized by many people. The district-assigned vehicle, however, is utilized by 1 person. So this is for work purposes only and not for the employee's commute. Personal purposes are prohibited. This also must be parked at the employee's work site or the department's address, with the exception of the following: a pre-approved overnight trip, if the employee is on call with essential work equipment, and that essential work equipment does not include communications equipment, or the employee is part of a regional team or a field staff with more than 1 location. These classifications of employees must park in one of the pre-designated regional parking facilities in the location where they work, and not the location closest to their home, which was, again, one of the findings for the audit. And last, I wanted to add, parking at these regional facilities does not make this a take-home vehicle. And the third is the take-home vehicle. This is assigned to 1 employee and may be used for commuting purposes. De minimis use is permitted with this vehicle. That includes commuting to and from work, stopping for a personal errand on the way home, traveling to and from lunch, medical appointments, and other minimus use. These employees must obtain and maintain automobile liability insurance with limits of $100,000, $300,000 bodily injury, and $50,000 personal damage, and that's because the employee is personally liable for any damages resulting from the employee's own negligence, misuse, or abuse while operating the take-home vehicle. This is in compliance with all IRS rules, and the employee will be subject to imputed income requirements at the end of the year. Authorization for these take-home vehicles may be restricted and revoked at any time without cause. Any questions?
Any questions? Mrs. Andrews?
Can you tell me about the regional parking facilities? Where are they and how are they used?
Absolutely. So at the beginning of last year, we did a collaborative effort with our Director of Facility Services at the time to determine 6 locations around the district that were lit appropriately, secured, and had space for district vehicles. Now, over time, as you can imagine, that changes. So those 6 facilities were determined by having a conversation with the principal, so between the principal and facility services and transportation, to determine those locations. And on an annual basis, we plan on reassessing those areas, and they are geographically located around the district to make sure that we're taking care of our northwest, south, and central regions.
Mrs. Andrews?
Just to follow up, because I'm not quite sure if I know where one of your regional facility parking areas are when I'm out walking. And I see an area that seems to have a lot of our cars parked there, and there's no fence around that area. I mean, I could just walk up and break a window, do some damage to the vehicle, and that's been a place of parking for a while for the school district. So, I'm just wondering, people are asking me, is that where you all park your cars? There's no security there at night, even though the principal may say, yes, it's a good thing. I know one that has no fencing, and I can just walk up and do damage. So how does that work?
If you do hear of something like that, actually, maybe we can connect and get that location.
Ms. Andrews, I'll reach out to you and get the location, and then we can look at it a little bit closer.
Yeah.
But one of those provisions that, when we designate it as a regional, working with the principal and so forth, we want to make sure that there's security for the vehicles to protect our property. Mm-hmm. So if we can have a conversation later, I'll get that location and see kind of who's parking there, mm-hmm. along with the transportation department, and make sure it's one of those regional areas.
And maybe we can find out where they are so we can be knowledgeable.
Absolutely. Mm-hmm. I'll send you that information.
Any other questions? Mr. Superintendent?
Yes, sir. At this time, we'll go over policy 6.185.
I would ask Allison to come back to the table, please.
Hello again. So school food service management policy. The scope of this policy, the purpose of this policy is to provide for an appropriate food and nutrition program for district students that is consistent with federal and state laws and regulations and ensures district students are provided well-balanced, nourishing meals. Inside the policy statement, we've added the fresh fruits and vegetable program into the list of authorized programs that we can participate in. We've also added that charter schools may be eligible to participate in the at-risk after-school meal program, and that they agree to follow all guidelines as required by USDA, FDACS, DOH, and of course the district. For our unpaid meals and overdrawn account section, we've added that the following possible methods of collecting unpaid debt can occur. The consequences for students, which would be inclusion on the school's obligation list, the unpaid balance following the students from pre-K through 12th grade, and restriction from various school events or activities. Currently, the inclusion on school obligation list is not occurring, but that does occur for other things like textbooks, and we do have the balance following the students already from pre-K through 12th grade. Also, the use of an assistance account for donations. We do have a donations item area on our website where people can donate, and we would put that money toward this account, or also PTAs or other donations can be made to this account for students. And then finally, the use of the general operating fund for reimbursement to the school food service grant fund. Any leftover balances cannot come out of the school food service fund. In sale of competitive foods and beverages, we've provided additional language to explain the definition of school-sponsored fundraisers and the USDA rule about combination foods. A combination food is contains both a protein and a grain. And modified the section about vending machines, school stores, and snack bars to allow for sales at any time during the school day as long as foods are Smart Snack compliant. So that's going to be a great help for the schools that are trying to do get additional funds. Confidentiality and disclosure. We clarified who can receive free and reduced student data per the USDA, and we added the name of the new form for the disclosure of students' lunch status information. Compliance with sanitation and health regulations. We added school food service staff is not permitted to store, reheat, or cook foods brought from home with the intent to serve to children. And for food donations, we allowed for leftover foods to be donated to nonprofit institutions like soup kitchens and homeless shelters. For responsibilities of school food service, we've added information on hiring and training of all school food service personnel, and we've added that school food service administers the wellness promotion policy. The responsibilities of school principal and school staff, we've added that principals can complete a meal application for students whom they are aware are eligible for free or reduced price meals, but whose parents or guardians may not have applied. Food prepared and or served in the school kitchen outside the school food service program must be done so only under the supervision of the school food service staff, and that school food service staff must agree to any overtime activity. And principals must ensure a healthy school team is established and the assessment is completed and submitted to school food service each year. That's per Florida statute. Food prepared or served outside the program. We've added that staff's time spent either prepping or serving that creates the need for additional labor hours, as well as the food costs and labor costs of such events must be fully reimbursed to the school food service department by the school or sponsoring group, and that's due to grant requirements. Food brought on campus to be prepared and served by school food service staff to students must come from a licensed food distributor. Anytime the kitchen is being used, either by school administration or by outside group, a school food service staff member must be present. If raw meat, poultry, or fish are being prepared, the school food service staff must be HACCP certified, and all of our managers are currently HACCP certified. School food service employees are not permitted to volunteer in the capacity of their normal job responsibilities. Any questions?
Mrs. Whitfield?
I just have two. The first one is about the assistance account. Can you explain how that's going to work? The actual
We
mechanics
have
of it?
actually assistance accounts now, so we have a generic principal's account at each school. If the principal wants to utilize that, they make prepayments, either they do or PTA or donations coming in, goes into that account, and then as the child comes through the line, they're noted they don't have the money, and then it's noted down, and then it's taken out of that account.
So the
Instead of-
first time that the child doesn't have the funds, would it come out of that account, or is it for someone who's chronically missing the ability? I know, because I'm just thinking the school food service department does cover a meal for a student if it's like within, 2 weeks? You give them 2 weeks to not pay?
We cover, at elementary schools, we cover 3 meals. So we would charge, we charge 3 meals. And that's before the turkey and cheese sandwich kicks in, which we've changed up that so that they get a full meal with the turkey and cheese sandwich at elementary schools. So it would be at that point where they were going to exceed their credit, and then that money would get paid out of that account. Or it would be right away, either way, so that it doesn't get to that point.
So I just want to make sure once we get to a point where a student has their, if a school doesn't have an assistance account, a student can go up to a certain amount of time until they are able to be cut off and go into these restricted circumstances?
Yes, in the current policy, it's that for elementary schools, they have 3 meals, so they can forget their money 3 times, and we just charge their account.
Okay.
And then we start sending the phone calls out. Phone calls go out Monday through Thursday to the parents, letting them know if their child didn't have enough money that day for the meal. So they can do that for 3 times. At the 3rd time in elementary schools, in the policy right now, the students would then come through the line. They would have to go back and see the manager. The manager would have, let's say they got spaghetti. Instead of having the spaghetti, they get a turkey and cheese sandwich. That turkey and cheese sandwich is an item in elementary schools that's served every day, so they could still go out and sit next to their friend who may have selected to have a turkey and cheese sandwich. So it used to be a long time ago that those kids would only get a cheese sandwich and a milk or a juice, but now they're getting that. So now in middle school and high school, they get the one charge. They can forget their money once, and then they do get the cheese sandwich with the milk or juice in middle.
The only concern that I had about this really is that I know that we have systems in place to make sure that kids eat, but I don't know that the kids know that there are systems in place. So when a kid forgets their money, I've heard and I've seen sort of that students are will just sit and just not eat. And so I don't know if there's a way we can spread the word out that, you forgot your money today. We don't want you to go without food. There are options that they could do this, or they could, get an account or something like that. So I don't know if there's a way we can sort of get that out to the principals to market it better, or have, especially in elementary school when it's the little kids, have somebody watching them to make sure that they're not missing out on eating. That part bothers me. Okay. The other thing that I noticed is that you put in here the use of general operating funds for reimbursement. Has that ever happened? Have we ever taken money from general operating? Because usually it's the opposite way. You guys have more money than general operating, right?
Yeah, we have a lot of indirect and direct costs. This is one of those that, per the guidelines for USDA,
We have to have it.
it has to happen. It has to come out of the general operating fund. and be if we have a negative balance left over.
But we've never done that? Not that you know of?
No.
Okay. I was just curious.
But we're trying to get into compliance there, so.
Yeah.
Yes.
Okay. All right. Thank you.
Mrs. Brill, then Mrs. Andrews.
Thank you, and I'm really happy to see that you added in there into the policy that principals can complete a meal application for students who they were aware are eligible but have not completed the packet, because I do worry, just like Mrs. Whitfield, about those kids that slip through the cracks. So my question for you, and maybe it's for the superintendent, is in the policy itself, which I have not looked that closely at, do we have a pipeline where the teacher, in the policy for teachers to report to the principal when they suspect that there's a student that's eligible and they have not completed the packet? Because I don't know how principals, we have some schools with, well over 1,000 students, thousands of students. How do they keep track, even at the high school level, of those students who they are aware are eligible? So if it doesn't exist, I guess my request is that we find a way to put something in the policy where when teachers identify students in their classrooms that they will report it to the principal, who will then, proceed with an application.
Yeah, we can look into that, and we do have something that we work with the schools individually as they're requesting, and through our school food service managers. It's a need app list. So as we approach what's called the temporary approval timeline at the beginning of the school year, we share that list with the principals, and those are the people that have not yet completed an application. So yes, that might be something that then they can share with teachers.
And just as a follow-up, and maybe Mrs. Whitfield's request about the kids that are just sitting there, we can find a way to fit it into the policy, because I don't think the onus should just be on the principal. Mm-hmm. It takes a community. It's all of us. It's the teachers. It's the paraprofessionals. It's everybody. So if we can find some language to wrap it around and make sure that it gets up to the principal, I think that would be very helpful.
Okay.
Thank you.
Mrs. Andrews.
Can I say something? Let me have staff look at that. I'm questioning whether or not a policy that then would have to be a directive. So let's just see what our current practices are, because there are some families who do not want to fill out that paperwork. Mm-hmm. And so I want to be very clear we don't force something on people who do not want that.
Just as a follow-up, it's not meant, I did not intend for those families to have to do it. There is a level of, there are people that will not fill it out. This is for the principal to do it, but we've got to find a way to capture those students where the families have not filled it out, where the teachers or the people working with the kids know they're not eating, and that we can find a way to be able to help with that.
Yeah, we'll look into it. I know principals put forth Herculean efforts to get people to fill out the forms and identify them, but let staff look at that and we'll get back to you.
Mrs. Andrews.
Thank you, Mr. Barbieri. I just want to find out about the data. When I see this part that says consequences for students' inclusion on the obligation list, unpaid balance, they could actually not be able to participate in activities and school events. Do we keep a record to see who are we talking about so that we kind of know who these children are? If they're not going to be able to participate in school events or activities, may not get their report card, because once you get on one of those obligation lists, lots of bad things happen to children. So I would just want to know, how is that working? I love hearing that you've got ways to monitor and you're going to feed everybody. So do you have a lot of kids on this obligation list that's actually restricted from participation? Do we have any data on that?
Currently, that we are not doing that now because it is not policy right now. So they do that for the textbooks and maybe other things, but school food service has never been included in that. So what happens is that just that balance just rolls over until 12th grade, in which time if they don't pay, then the district has to pay back. So we're trying to find a way to get the parent to understand that this is their obligation. So we have who owes money and who has charged, or who is receiving that turkey and cheese sandwich time after time after time because they're not paying for the meal. We have that data, but we do not have any data about if we put them on an obligation list, will that have solved the problem, how many will be on the obligation list, because we haven't gone to that route yet.
Just to follow up, Mr. Barbieri, I just worry about them being on the obligation list because I'm not thinking about at graduation. I'm talking about if they can't go on a trip or can't participate in an activity. I don't know who these people are that we're talking about here. And parents may not understand that if their child can't participate. So I was just wondering, how do we tag these children so that parents can know that they're not able to participate because of this obligation?
Mrs. Whitfield?
Thank you. Is it a mandate of this grant that we have to have this piece in there? That we have to start following up and?
No, that line is not. That was just an idea of how we could not have it impact the general operating fund at the end of the year. So
could
that
we,
is mandated.
Yes. Could we see how many students we're really talking about that would then be put on this obligations list? Could we look at that and get that data before
Sure.
we approve this?
Yes.
That would be great. Thank you.
And if
Dr.
we do
Robinson?
go in this direction, we could also work with the principals before that happened, so that there be communication there as well.
Dr. Robinson?
Thank you. So I'm glad that you two brought that up. I want to push back vigorously on that because somehow it just doesn't seem right to deny a child the opportunity, say, to go on the field trip because their parent could not or did not pay, right? So I'm just not willing actually to consider that. I'm just not, right? So I recall, and I would need to look at the policy to refresh my memory, but I recall with textbooks that we included some alternative way for them to remedy the situation. I don't remember now what it is, but I'm just going to request that we find ways to address this that don't punish the children and their educational opportunities. It's just not working in my mind. But I have a couple of other questions. So this, I've got to be overreading this, but this on line 455, the school food service employees are not permitted to volunteer in the capacity of their normal job responsibilities. Help me understand what that means. Does that mean that I can't cook for my church? Is that what you're saying?
No,
Okay.
with the school district, inside the school, the fair labor laws say that if I'm prepping, then I can't come in and prep for a volunteer activity that's happening at the school. I can't volunteer for that. I would actually have to get paid for that. So all of our staff members that are prepping food, they can't come in on a Saturday and not get paid. They have to get paid to come in.
Okay, so I have a couple of other issues that probably are a little bit more difficult. So when are we going to address high fructose corn syrup? You know it was coming, right?
Yeah, I did. I actually, yes.
Yeah.
Yes,
When are
and
we
we
gonna
have, yes. High fructose corn syrup is through the bidding process, and that was in the wellness policy that we've added it in there, that through the bidding process, we're going to a clean label. So high fructose corn syrup is pretty much totally out. We even changed over ketchup, but we do have some things, syrup, that has it in it. There are a few of the syrupy type things, sauces, that may have it, but we've pretty much eliminated that. We also have in all of our bids the ability to go to the next lowest bidder if they have artificial colors, artificial flavors. So we're definitely looking at clean label as we move forward, and we have been doing that for a number of years. Yes.
Okay, that's great.
Thank you.
We really need to publicize that. Seriously. Okay, and then, so one that might be a little bit harder. Why do we have, I don't know if it's policy or practice, but why do we not allow private healthy food vendors to sell in our cafeterias? So, one of the fruit smoothie kind of companies sell in our cafeteria.
That's actually one of the things that we've just opened up. So for Smart Snacks guidelines for the USDA is very clear as to the timing when things can be sold to students outside of school food service. So it has to be either in a vending machine or a school store or a concession stand that is a permanent area. In those areas, they can sell as long as it's Smart Snack compliant. So, it used to be that they couldn't sell at all throughout the day, but that you can't do fundraising throughout the day. So at the beginning of the school day, which starts at midnight, all the way through a half hour until the end of the lunch period, nothing can be served that is not, for fundraising, that is not Smart Snack compliant. I'm
So,
sorry, you
wait,
can't
let
serve
me ask
anything
it
at
a
that point.
different way.
Let me pull it.
Well, I got that timing piece,
Yeah.
but I think I'm asking a different question, and I'm not
Okay.
making myself clear. So, in especially like our high school cafeterias,
Yes.
could we? What would prohibit us from having, Debbie Smoothies Company set up in a permanent area, meets those guidelines, and I'm a vendor who's selling directly to the students in that space, and maybe part of my contract means that I'm also doing some health education in nutrition or something like that. I want a side benefit, but
Right.
why don't we go that route at all? Because in the past, it seems that the door was slammed on that, and I don't really know why.
Right, it's USDA, so if it's considered now, with our new policy, if it's considered smart snacks, then, and it's not a combination food, so that would be the grain and the protein together, then it can be served if it's a permanent location, that they have a snack bar, and they're doing that all the time. If it's considered a fundraiser, that's where it can't occur. And that's by USDA.
Okay, I think I'll follow up, because
Yeah,
I'm
I can
talking
get you
about a vendor.
A permanent, right, a vendor,
About a
right.
vendor.
So
Okay.
yes, if it's smoothie, it's smart snack, a permanent vendor is coming in, and then they can operate. But if they're coming in and they want to serve pizza, they can't serve the pizza because that's a combination food.
Okay, thank you.
Yeah.
Can you explain what the at-risk after-school meals program is?
Yes, that's actually our supper program. We call that's through the health department. It goes through the USDA, comes down through the Department of Health, and that is our supper program. We have that in 71 schools currently in the district. We started that a few years ago and have been expanding as we go. So it provides a full 5-component supper to students after school.
And these are at-risk students only, or is this all
It
students?
has to be in schools 50% or greater, but once it's qualified in that school, they have to have an enrichment program after school. They have to be 50% or greater free and reduced. And then once we qualify the school, anybody that is there for an activity can participate for free and get a free supper.
Okay, so would you look at line 31 and 32? It says that this talks about charter schools, and it says that those kids may be eligible to participate in the at-risk after-schools program. Why doesn't it say shall be eligible to participate provided they follow the guidelines? Who decides whether it's may? Who tells the charter school that these kids that are in these situations where they need food aren't able to? Why does it say may?
Because we work with the schools and the principals and the managers and determine where it's going to be a great fit for the school. We haven't rolled it out to all schools because of staffing, because of storage, because if the principal is saying that they don't want to have the kids have the supper program. So it's the logistics of it. So we need to be able to make that decision whether we have it in a school or not.
So I just want to make sure we're not arbitrary, kids are kids, whether they're, if they need to eat, whether they're in one of the traditional schools or one of the charter schools. I mean,
Oh, right. It's not whether it's charter or not. We wanted to include the charters. That's why we put it in here. They weren't included before.
that's why I'm asking, why does it say may be eligible to participate
Well,
then shall be eligible to
Right,
participate?
it's the same thing as, right, they are eligible. It's just that they may not get it because we may not be servicing either that school with supper or one of our base schools with supper because of other extenuating
Okay,
circumstances.
so we can change the word may to shall, so they
Yes.
shall be eligible to
They
participate.
shall be eligible, but we may not select them to participate.
Got
Is
it.
that,
Got it,
okay? Yeah, we can change that.
okay. Mrs. Andrews?
Thank you. And this is what I've been working on with the superintendent, because I'm not quite sure if the principal decides whether they can have the supper program. I'm not sure if any of the Glade schools have this program. Can you help me?
Yes, they do. We can get you a list.
Okay.
Any other questions? Thank you very much,
Thank you.
Mr. Superintendent.
Yes, on policy 7.28, Ms. Paul?
Policy 7.28, display of the state motto in school district buildings. Purpose of the policy is to comply with Florida Statute 1003.44, which requires the board to adopt a policy mandating and governing the display of "In God We Trust" in each district-operated facility. The policy formalizes use of the state seal of Florida to comply with the requirement as already authorized in writing by the board.
Mrs. Whitfield?
Thank you. I feel compelled to say something on this. I want the community to understand that personally, I think this is a more respectful way to do this than currently. Currently, to comply with this state law, we have printed out on a piece of paper at the schools and stuck on the wall, "In God We Trust." This is I believe, much nicer looking way to do this compliance with this law. I'm super in support of this. I think this is a good way to accomplish this and also respectful of all the people in our community. So to me, this is a great idea that Mrs. Brill had, and I fully support it. And I just wanted to make sure that people understand that this is, I think, a better solution than that we currently have.
Mrs. Brill?
Thank you, and thank you, Mrs. Whitfield. But I just wanted to remind everybody that it actually came to me from teachers. So this was a thank you, big shout out to the teachers that called me to bring up this suggestion because it was being used in other districts. So I don't want to take credit for it. I just brought it forward, but thank you very much. And I do think it is. I think it's a wonderfully respectful way for us to follow the statute. Thank you.
Any other questions? Thank you very much. Mr. Superintendent, do you have anything else before we move on to the board discussion items?
No, we have one more. We have another workshop.
Okay.
At
The
this
budget
time,
workshop.
I'd like Mr. Mike Burke, our Chief Finance Officer, and Ms.